Hello everyone, welcome to another video. So in today's video we'll be talking about another very interesting topic known as cholelithiasis. And basically cholelithiasis refers to gallstones. So it refers to the formation and the presence of gallstones within the gallbladder. So gallstones, what are gallstones? They are basically hardened deposits typically composed of cholesterol, composed of bilirubin, bile salts, and they may range in size from a grain of sand to several centimeters. So they remain silent or cause complications like inflammations, obstruction, or infection. So a patient that has this cholelithiasis can be asymptomatic and can be symptomatic. So gallstones are a common digestive disorder affecting 10 to 15% of adults in developed countries, while many remain asymptomatic. Up to like 25% may develop symptoms or complications. So there are more people that develop symptoms when they have these gallstones. So women are usually at higher risk of getting this cholelithiasis compared to men, and the prevalence increases with age. So older people are also at higher risk of getting it. So looking at the cause, number one, supersaturation of the bile with cholesterol, then also having an impaired gallbladder motility or emptying, and then increased bilirubin production that is seen in hemolytic anemia. Then infection, so certain bacterial or parasitic infections can cause this, and sometimes genetic predisposition. Then some risk factors include obesity, like I said, is more common in women. Then pregnancy too, and when there's a case of whereby an individual has a rapid weight loss. Then diabetes, having liver disease, using frequent use of oral contraceptives, and also when you have been in like this prolonged fasting. So all these are risk factors of getting this condition. So let's look at the signs and symptoms. So sometimes cholelithiasis is often asymptomatic. Then there could be biliary colic when it's symptomatic, like having intermittent right upper abdominal pain, often after having fatty meals, like all these burgers, all these, so after having all these fatty meals there will be biliary colic. Then nausea and vomiting, flatulence and bloating, fever and chills, then jaundice. So if jaundice could occur if the stones block the common bile ducts. Then also clay colored stools and dark urine is also a particular symptom. So the gallbladder, it is a pear-shaped organ, and is found, basically is a pear-shaped organ that is found beneath the liver, and it stores and concentrates bile. So upon eating, it contracts and releases bile through the cystic ducts and common bile ducts into the small intestine, aiding in fat digestion. So in cases of cholelithiasis, the balance between bile components is disrupted, leading to precipitation and stone formation. So obstruction of bile flow will lead to inflammation, pain, and systemic effects. So for looking at the pathophysiology, there's the supersaturation of bile with cholesterol or bilirubin, which leads to crystal formation. So crystals aggregate to form stones. Then gallbladder stasis, that is delayed emptying, worsens crystal growth. Then stones, these stones, they can obstruct the cystic duct or the common bile duct, causing pain and complications like cholecystitis, pancreatitis, or cholangitis. So other infections or diseases that could mimic the symptoms of gallbladder, gallstones, I mean, we have peptic ulcer disease, acute appendicitis, pancreatitis, gastroesophageal reflux disease, irritable bowel syndrome, hepatitis, and also renal colic. So how is this condition diagnosed? So first, they will do this abdominal ultrasound. So abdominal ultrasound is highly sensitive for gallstones. Then also liver function tests to check elevated bilirubin, alkaline phosphatase, and transaminases in the bile duct obstruction. Then also a complete blood count will be done, which may show leukocytosis in cases of infection. And then amylase test and lipase to be checked to rule out associated pancreatitis. Then endoscopic ultrasound too could be done, which is highly sensitive for bile duct stones. So these are just the various ways that these gallstones could be diagnosed. So for the treatment, the general treatment approach is based on symptoms, complications, and the patient category, like if the patient is an adult, a child, or the patient is pregnant. So generally, asymptomatic gallstones that don't come with severe symptoms or come with any symptoms at all, no treatment is needed unless there are risk factors present, like if the patient has sickle cell disease, or if the patient has porcelain gallbladder. So unless these risk factors are present, no treatment is usually needed. So for symptomatic gallstones like biliary colic, for the pain relief, we could give a diclofenac injection, 75 milligrams intramuscularly. So for the pain relief in symptomatic gallstones, we could give diclofenac injection, 75 milligrams intramuscularly, then 50 milligrams orally every 8 hours. Then alternatives to this, we could give morphine or pentidine injections if the NSAIDs are contraindicated. So also looking at the symptomatic relief, we can give anti-nausea agents like metoclopramide, 10 milligrams every 8 hours, or ondansetron, 8 milligrams every 8 hours. Then antispasmodics too are used, like hyoscine butyl bromide, which is given intramuscularly or intravenously. Then in cases where the patient has complicated gallstones like cholecystitis, supportive care that could be given, like giving the patient intravenous fluids, monitoring their electrolytes, and antibiotics can be given in this case to like ceftriaxone in combination with metronidazole. Then in severe cases, we could give piperacillin and tazobactam IV every 8 hours. So some definitive managements, like when it comes to surgical management, so there's something called laparoscopic cholecystectomy. It is the gold standard, and it is done electively or urgently depending on the complications. Then there's also endoscopic retrograde cholangiopancreatography, which is done for bile duct stones. Then non-surgical options, if surgery is not feasible, we could give ursodeoxycholic acid for cholesterol stones. And then in special populations, that is in children and in patients that are pregnant, like in pregnancy, we give conservative treatment first, like giving fluids, paracetamol, dansetron. Then surgery is only done in the second trimester if it is needed. So when it comes to pregnant women, in most cases we have to be very delicate with the treatment options that we want to consider, because we are dealing with two people in this situation. Then for children, usually deoxycholic acid is given, or surgery, depending on the symptoms, how severe the symptoms are in the child. And then for elderly patients, early surgery is often safer due to the higher risk of them getting complications compared to others. And after giving all these treatments, it's good to monitor the patient and always do follow-ups, like based on the medications that are given, based on the tests that have been done, and also request for further for the patient to do like further tests to know if the treatments that you are giving is actually working. So send them for complete blood counts, liver function, and also if they went through the surgery, like monitoring of the surgery site, the place where the surgery was, the place where the person had the surgery, in the particular part of their body. And also when you are giving pain relief too, you can ask the patient the questions like, is the pain relief, like, is it actually giving them relief, or they need a higher dose? And also even giving that higher dose, you have to monitor how the patient responds to it. So just regularly monitoring these treatments and follow up is very essential. So prevention for this cholelithiasis, we have some preventions, like number one, eating a high fiber diet or a low fiber diet, and also avoiding prolonged fasting, exercising regularly. Exercise is like the therapy for most infections, but we don't usually consider it as, okay, it's a therapy. But exercise is both good, like it's very good for the body. Just warming up the body every day can go a long way. And also avoid rapid weight loss. Like, if how do I even explain this? Avoid using all these teas or all these concoctions that can easily make you lose weight, lose very significant weight. So that's also a preventive tip. And also try to maintain good, healthy body weight. Like, don't have a BMI that is reaching like 40 or something. Like, having a good body weight is also a very good preventive measure. So looking at the prognosis of this cholelithiasis, so in asymptomatic patients it is excellent. And then for patients that have symptoms, it is good if the patient is treated and if they respond to the treatment, and especially if they are treated surgically. Then in complicated cases, it depends on prompt diagnosis and prompt intervention. And usually recurrence after surgery is rare, but it is rare because surgery is like the best form of treatment. It is rare, but it can still occur, but in rare cases. And in pregnancy, early recognition and appropriate management prevents poor outcomes for both the mother and the baby. Yeah, so that is basically it for this that's basically it for this topic. So I've talked about the overview, the pathophysiology. So I don't know if I mentioned, if surgery is required in pregnant women, it's better to do the surgery if she's in her second trimester, because it's the safest time. And we should avoid NSAIDs, and you should avoid giving NSAIDs in the third trimester of pregnancy. And usually when children have this cholelithiasis, is often due to genetic or blood related conditions, and usually gallbladder removal is preferred if symptoms or complications develop in children. And all medications, they must be dosed by weight, and so deoxycholic acid is the best to be given. It can be given in some children, and also in older adults that higher risk of complications of gallbladder rupture or infections. We have to monitor for kidney problems, dehydration, and also medication side effects due to how sensitive, due to the fact that they are at higher risk of getting severe complications from this condition. So there's a non-surgical therapy that I did not mention. It's called shockwave therapy. It's rarely used, but in shockwave therapy basically uses here we use high energy sound waves to break up stones. So it works best when it's combined with bile acid therapy, and is usually reserved for patients who cannot tolerate surgery and have like very small number of stones. So usually bile acid medications is like the most common, is what's commonly used, like as a when surgery is not possible. And it works, this use of deoxycholic acid works best for small radiolucent stones in functioning gallbladder, and is usually given for 6 to 24 months. And when we're giving it, we have to monitor for liver function tests and digestive side effects, because they are basically used to dissolve cholesterol based gallstones in patients who cannot do surgery. So this is usually the best option in patients that can't do surgery. And then when we're also talking about this surgery that the patient does for these gallstones, like the laparoscopic cholecystectomy, so it's usually done electively once the patient is stable, and if gallbladder inflammation is present, it is performed within 72 hours of symptoms starting. So after surgery, the pain is managed with paracetamol and low dose opioids if needed. And then there's also the routine monitoring for surgical complications like bleeding, bile leakage, or wound infection. So that's basically it. Yeah, that's basically it for this topic known as cholelithiasis. Thank you.